Good evening and welcome. We'll just wait a few more moments until everybody arrives. You're in the right place. I'm looking forward to speaking with you this evening and showing you all about care fertility. Just wait a couple of minutes, or no moments, not too long. Okay, so let's get started. So a very warm welcome to everyone joining our virtual information event this evening. It's called Paths to Parenthood. I'm Alison Campbell. I'm Care Fertility's Chief Scientific Officer, and I'm going to be hosting this event tonight. So before we get going, just so you know what to expect from the evening, we'll probably last about 40 minutes. We always say that, but it generally runs over a little bit. So maybe 45, 50 minutes. We've got 3 short information videos throughout this event, all about care fertility and our team. And I'm going to be walking you then through a typical pathway from consultation to embryo transfer. We've got diagrams, photographs, we've got videos as we go along. So hopefully it'll be really informative. And we're going to intersperse this presentation tonight with a Q&A session. So that's with myself and Dr. Tom Bamford. So we're very pleased to be welcoming him this evening. Now, as we go along, you can ask questions in the private questions tab or else in the public chat. And if you use the public chat, then just be mindful that everybody in the event will be able to see just your first name. You can also contact us using our email if you want to ask for a little bit more information or you want to send your questions that way. And that email is events@carefertility.com. And as always, if we don't have time to answer your questions during this event, we never know how many questions we're going to get, and we've had some sent in already. And then if we can't answer them tonight, we're going to be able to send you a reply via email. So we'll answer all the questions very soon, within the next day or so at the latest. But hopefully we'll be able to address most of them tonight. And if you think of anything later after the event, you can always come back and email us on the event's email address. So I'm pleased to say also that I believe we've got some people on the phone lines, although I did hear a rumour that they were on the blink. So hopefully we'll get those phone lines resolved till 8 o'clock this evening. The number, if you want to call us, 0800 564 2270. So let's start with a short video introducing you to care fertility.
Family. It's who we are and who we're always going to be. It's the important little moments, the big emotions, the beating heart at the centre of our world. It's the journey that we take there, together, one step at a time. Family is the one thing we'll always care about the most, because we believe that family is for everyone. And through our care, we'll do everything we can to make your dream real. We don't just care, we are care.
My name is Professor Charles Kingsland, and I'm the Group Clinical Director for Care Fertility. At Care, our number one belief is family for everyone, and this means we do everything possible to help everyone start or grow their family. We know that nothing is as important as family, and that's why we care so much about wanting to give every patient that comes to us their best chance of having a baby. Of course, families come in all shapes and sizes. We get heterosexual couples, couples of the same sex, we get single patients wanting to start a family, we get NHS patients. When you have a fertility problem, there should be facilities available for you to get the best advice and the best treatment readily available to give you the best chance of having a baby at a time in your life that is best for you. We will use all our knowledge and experience combined with highly individualized treatment, personal treatment, to help you have the family you are longing for.
Unbeknown to Gemma and I, we both carry a gene a deafness gene. We actually have a daughter who was 3, but who was born prematurely deaf. And we were given the option and chose to go down a fertility treatment to kind of avoid our second child having that same gene.
We were very lucky in the fact that the clinic was only down the road from us. So we felt there was one around the corner. It had good reviews. We just felt it was good for us, didn't we?
The whole package made us just feel really comfortable that actually going with Care was the right decision.
So the team that we worked with at Care were unbelievable. They were caring, they were sensitive, they were compassionate, empathetic, and even when I was ringing out with I was feeling pains down one side, that the reassurance that they gave me, they honestly do hold your hand every single step of the way, and I feel like they lived the journey with us.
So I've had several treatments with Care, and I now have a baby, and that's taken a number of treatments, fertility treatments, different alternatives, different medicines to try and get it to work for me. I have always said I would recommend Care Fertility. I would recommend them for the comfort factor that I received, the friendliness, and just I think the word is my faith in Care Fertility.
Okay, so hope that you enjoyed that short film. Now we're going to go through a slide presentation. So I'll introduce you to the group of our clinics and talk about a typical treatment cycle. So a bit of background, about 1 in 6 people need help starting a family. And as you heard in the video, I hope the sentiment came through, we really believe that family is for everyone. We help all different types of patients with a large selection of treatment options, so very much depending on your situation. So during this event, we're going to focus mainly on the general IVF process, but whether you have treatment with your own eggs and your own sperm or with the help of a donor, the principles are the same. So here's a map of the UK, and you can see that we've got fertility clinics across the UK and also in Dublin, and lots of satellite facilities which feed into them. So with this arrangement, our patients can get the benefit of the knowledge that we pull from all of the staff that work across our network of clinics. So we have both the best of both worlds, really. We have the local friendly clinic facility, but a huge world-class knowledge base with all these experts, right from the scientists and the doctors, the nursing team, the administrators. So we all work together to get the very best for our patients. Now, it's really easy to get started with Care. I think we've got a nice photograph of Shah, so we'll hear from her a little bit later on. Am I driving these slides, Chloe, or you? Let me see. Oh, there we are. This is Shah. So she's from our general inquiry team, so she's the manager. And so we have a team of wonderful staff who take inquiries, and they're very friendly and knowledgeable, and they can answer all your questions and really explain how to get started if you want to come and join us for a treatment cycle consultation. And we've got members of this team on the phones this evening. So the next slide, we're going to start with the diagnosis. So getting the right diagnosis and gathering information from you is really important so that we can give you the very best advice. So we've got a secure online patient portal where all the information related to your treatment is held. So if you've had previous treatments or you've got test results, maybe through your GP or consultant somewhere else, they can easily be uploaded to our patient portal. So there's no need to repeat all of the tests. So often we can use information that's gone before. And all of this information is reviewed by one of our consultants prior to your consultation appointment. So next up, so this is just to demonstrate the portal. So it's really easy to access. Once you're registered with us, you can go on there, use it mobile or laptop, tablet, any way you want to access it. and I've recently had a play with this myself. It's really impressive. So you can have all your documents in there. We can contact you through there, and you can contact us. So everything there is there in one place. So it's really well organised system. So the consultation comes first. So once you've registered with us, we will give you a consultation appointment. This is George. He's one of our consultants from our team in Sheffield. And in your initial consultation, your fertility specialist will listen to your fertility plans and your wishes. And then they're going to go through any existing test results or medical history that you've that's relevant to your fertility. And they will discuss the treatment options with you and the various chances of success, because often patients are faced with multiple options. So it's important to give all of the information and the options and also the chances of each type of treatment and intervention so that you can make an informed decision. So our intention is that when you go away from this consultation, you're going to have detailed information about all of your options, and you can consider those in your own time. You'll know how and where to get the support that you need from our team, and you'll know if there are any costs related to treatment that you may be discussing, as well as the potential success rates. So when we start treatment with you, after your consultation, the clinic teams are available answering any questions that you might have. Things I know can come to you after your consultation. So we're there every step of the way just to help you to navigate the treatment, really. So starting treatment, everybody's treatment, of course, is very different from each other, but we pride ourselves in giving this individualized treatment. So our treatment offerings can start quite simple with intrauterine insemination, for example, and progress to quite technologically advanced, more complex treatments. So I'm going to spend a few minutes walking you through the typical pathway. Most patients that come to us need IVF, so much of this presentation and journey will relate to IVF, but the principles do relate also to other treatments that we offer. So ovarian stimulation starts first. So we have to get a good number of follicles on the ovary in order to collect a good number of eggs to try and maximize your chance of success. So you start with the medication protocol, and the first stage is the ovarian stimulation. So we prescribe medicine to stimulate your ovaries and develop follicles. You can see on this diagram here. And this is Di from previously from Tunbridge Wells Clinic. So she is here demonstrating how we teach you to administer your medication protocol. So one of our expert staff will walk you through so you can understand how you need to give yourself these injections. And we've also got online teaching videos, so you can watch those if you prefer, or you can just go back and double check if you've got any queries and you didn't want to come through and talk to us directly. So lots of ways to gather the information, because obviously everybody likes a different delivery of information, so we try and accommodate that as well. So the ovarian stimulation is the first point. You administer your own injections generally, and we start to monitor how those injections are working. So this is Rima, one of our doctors, a medical director from Care Birmingham. And we monitor the developing follicles using ultrasound scan. And this monitoring phase usually lasts, or the stimulation phase lasts, and the monitoring probably 2 or 3 times. We might expect you to come into the clinic so that we can scan and look how those follicles are developing on your ovary. When we think we've got a sufficient number at the right size, because we're measuring them with the ultrasound, then we will ask you to take a trigger injection. So this will help with the final maturation of the eggs. It's usually in the evening, because we plan the egg collection around 36 hours after that magic trigger injection. So the next thing is the egg collection. It's a really straightforward procedure, and we use ultrasound guidance to send a needle to these follicles, and we aspirate, so we suck the fluid from the follicles, and that's where we find the eggs. It takes about 20 minutes. It's usually followed then by a short rest, and you're ready to go home. So it's very routine, and most patients find it really straightforward. So if you're using donor eggs, we would usually thaw them around the time that the sperm is being produced. So you can imagine in the laboratories, we need the eggs and sperm to put them together. And so we've talked about how we get the eggs. Sperm collection is generally around the time of the egg collection. So normally at the same time in the morning, or it's thawed. Sometimes it's not produced the normal way, it's frozen and thawed, but we analyse the sample in a very similar way. And so sperm, here we are, we can play this little video. You'll be able to see it swimming here down the microscope. So the embryologists will always talk to our patients about how the eggs have been collected, the number of eggs, and how the sperm is looking, so that we can talk to you about the next step and bringing them together to create the embryos and fertilise them. So we've got the eggs and we've got the sperm in the laboratory. The next stage is fertilisation. Now, this is a really important part where we mix the eggs and sperm together. There are two ways that we do this. We can either use conventional IVF, so in vitro fertilisation, where we mix the eggs and sperm. So we've prepared the sperm and we've diluted to the right concentration and we mix them overnight. And the alternative is ICSI, so it's generally used when the sperm numbers or quality are low, and we can select a single sperm and inject it into the middle of the egg. So I think we've got a picture and a video perhaps of this. Well, there's, well, that might be coming later. This is Lena. So she's one of our embryologists. She's just moving from one of our clinics to another because we have quite a fluid and flexible workforce. So this is ICSI. Now, you can see there this fine needle, which is about 10 times finer than a human hair, is injected into the center of the egg. And the sperm is just going in now. And it's a magical technique, highly successful. It's been around probably about almost 30 years. It's been in routine clinical practice. I remember, I'm old enough to remember when it was first introduced. So that whether we mix the sperm for IVF or we inject the sperm like that with ICSI, the following morning, around 18 hours later, we will assess the eggs to see whether they've fertilised. And more than 95% of our patients do get very good news on the morning of the fertilisation check, and we confirm that fertilisation has taken place, and we'll talk you through what happens next. So following the fertilisation confirmation, embryos are mostly left undisturbed for several days in our specialised culture medium in electronically tagged, uniquely identifiable dishes. Very important and highly robust system where we use RFID tagging to identify individuals' dishes. And what we're doing is we're aiming to perform the embryo transfer at the blastocyst stage. So this is between day 4 and 6 after the egg collection. And most patients have several embryos to choose between, and we're really experts at choosing the best embryo. There are two main ways that we can do this. And the one is called Care Maps and one is PGT-A. So here we can see the time-lapse video of the embryo developing to the blastocyst stage. Little cells coming out now are showing that it's hatching. And it's a phenomenal technology that we can watch how these embryos develop. And we've recently introduced an artificial intelligence. We'll probably talk about this with Tom in a little while, but we've got a special tool that helps to analyse the development patterns of these embryos. And we call it Care Maps, and it's absolutely unique to Care. We've taken a decade of research and development to develop this technology, so we'll talk about it a bit later. It's a non-invasive method to assess the best embryo. The alternative is PGT-A, and we're seeing a video now of an embryo being biopsied. So it's another technology. It's mainly used for women over 37 years old, because as women get older, their egg quality declines and the number of chromosomes in the eggs can be incorrect. It's called aneuploidy, and it can result in the failure of the embryo to implant. It can cause a miscarriage or even a child with an affected condition. So our embryologists can biopsy these blastocyst stage embryos and take a few cells away and send them off for testing. And the result is then used to help us choose the best embryo, the one with the correct copy number of chromosomes. So we don't generally offer PGTA, this is PGTA with embryo biopsy, to every patient, but if our consultant thinks you would benefit, then we will be discussing that with you in your consultation. So the next stage, so we've chosen the best embryo. We've either used a traditional morphology, the shape of the embryo and the form of the embryo, and I know we've got a question about that, so we will also talk about that later on with Tom. So we've chosen the best embryo by the shape, morphology, either using care maps, so the kinetics, the development patterns, or by PGTA when we've done the biopsy. So 3 ways that we generally would choose the best embryo. Then we do the embryo transfer. So irrespective of how we have chosen your embryo, we do the transfer exactly the same way. So the embryologist loads the best embryo into a very soft catheter, which is then inserted through the vagina, through to the cervix and into the womb using ultrasound guidance. It only takes about 10 or 15 minutes, and then you can go around about your normal activities. So before you go home after transfer, one of our nurses will explain what happens next, and it's commonly called the 2-week wait. And that's after that you have the pregnancy test. So we'll generally provide progesterone medication to support implantation during this stage of treatment. So about 2 weeks after transfer, you do the pregnancy test, and if it's positive, then you'll come back to us for a scan a few weeks after that. If it's negative, then we will offer support. We've got counselling available, and we'll also arrange a follow-up consultation as part of the treatment. So you can discuss the next steps and how the treatment's gone, what went well and what we might be able to do differently to improve your chances if you want another treatment cycle. So we move on to donation briefly. We've got a large team of donation specialists at CARE. We've got our own egg bank, our own sperm bank. So we've got everything in place should you need to use donor eggs, donor sperm, or donor embryos. And our team's over 25 years experience. They've helped more people start a family with the help of a donor than any other UK clinic. So again, we support you through the entire process, from the initial questions right through to helping you select your donor. So moving on to support at CARE. So just to say a few words about the support that you receive whilst you're under our care. We offer free counselling appointments, and we've introduced a care buddy programme which links up people undergoing treatment at a similar time. So if you're undergoing treatment and you want to liaise and be supported by another patient, share experiences, then we can buddy you up with somebody. Seems to be working really well. We also hold regular online support groups. We've got a 24-hour, 24/7 care online forum, so you can chat with other patients, and it's all backed up by the continued support of our care teams, of course. So just before we move on, we'll just talk a little bit about care pay. So we're here to support you not just medically, but emotionally and financially. We have care pay, which is exclusive, individually tailored IVF funding packages. So these are designed by ourselves to give patients the financial peace of mind. So knowing that you have the funds in place if you need to fund your own treatment. We do NHS treatments, of course, as well. So we created these following lots of patient feedback. So it's managed entirely in-house by our teams, so our patients have a seamless experience. They don't need to go to a third party to try and arrange the funding. So we've got different packages, and they all include the cycle monitoring, the egg collection, all of the embryology, including the care maps, the kinetic algorithms, the AI that I spoke about. They include embryo transfer, freezing and storage of embryos, and unlimited embryo transfers. So it's time to move on to our Q&A session. So just as a reminder, we've got the team available if you need them this evening. If you want to ask questions, please use the chat or the questions tab, or alternatively the email events@carefertility.com. So I'd very happy to welcome Dr. Tom Bamford. Hi, Tom.
Hello, hi.
Nice to see you this evening.
Yes, thanks for having me.
Oh, you're very welcome. So we've got lots of questions, so we'll try and do quick fire. I'll host and fire them at you. Most of them actually come in so far are quite clinical, which is perfect because I'm the scientist, you're the medical expert. So we start with one about CMV. So is there a risk with CMV positive donor and a CMV negative recipient? So if you just tell us a little bit about what CMV is and then whether there are risks that we need to know about.
Yeah, so CMV is not actually something that we screen for in our donors at care, is it? So it's not part of our routine screening, and the reason for that is that it's not compulsory by the HFEA and the regulatory bodies. And when we've assessed it and kind of the HFEA and the government has assessed it, they've assessed that the risk is extremely low, and therefore it's really unnecessary. However, if you're using donors from international banks or kind of London Sperm Bank, those kind of things, some of them will provide you that information about the donor. So in general, if you're the recipient and you're CMV positive, then it doesn't matter what the donor is. You can have positive or negative donor. But if you're a negative recipient, so you're going to use that donated gamete, then you would want to have a negative donor as well. But our donation team can always advise you on that. Yes,
perfect. Thank you. There's another one here about stimulation. So we talked about that in a short presentation there. But the person who asked the question says, if I have low follicle numbers, am I put on a maximum dose of stimulation, or does it work differently to that?
So in general, if you're AMH, so we do a blood test as well as your antral follicle count, which is a hormone that is released from these follicles that we're seeing on scan. So that gives us a slightly more accurate picture, perhaps, of what your ovarian reserve or egg store is within the ovary. And then that helps your doctor dose your medication and the best type of treatment plan. So it's not necessarily just about the type of stimulation that you have, but also the way that we organize your treatment. In general, if you've got a very low ovarian reserve, you'll be on the maximum doses of stimulation in order to maximize your chances. There's very little evidence to put you on lower doses.
Yeah, perfect. Makes sense. But it's a tailor-made arrangement, isn't it? We need to understand the investigations that have gone place so far, and then tailor the medication appropriately.
Clinical history, it's not just as simple as looking at your AMH and creating a treatment plan. It's really understanding what you want to do with your treatment and what you're trying to achieve, and also your clinical history, your past medical history, and that can help us decide what the best type of treatment and drugs are.
Great, and that leads on perfectly to another question, which is, how do you use initial investigations to get a diagnosis, and then I suppose, and then decide what's the best treatment option?
Yeah, there's three main things that we do, which you will be recommended to have done before you see a doctor. The first two we've already talked about, which is the AMH, which is your ovarian reserve test, and a scan. And your scan is not only looking at your ovarian reserve, but it's also looking at your pelvis, your uterus, making sure that there's no abnormalities within the uterus, like polyps or fibroids, or anything that might affect a pregnancy implanting. And then the third thing is a semen analysis. And of course, this is if you're in a heterosexual relationship, and there's lots of variations out there for the type of treatment that you're going to be coming through to have with us. But in general, for most of our patients, that's what you would need. And then your doctor will go through your results with you at your consultation. And it depends really on the results. Of course, there's lots and lots of causes out there for fertility problems. About 35% of them are unexplained. A large proportion might be male factor. There might be an ovulation problem. So we take a history, and it's not just the investigations, and really try to understand what it probably is and how we can therefore tailor your management options.
Yeah, and our toolkit is quite extensive, isn't it? And I think that's a great thing, because we have all this expertise that we spoke about, this very large team. So if there's something that's quite unusual, we will always find somebody who's experienced it before and can advise. So I think that we're very lucky to have that vast knowledge pool. So there's a question here. Well, actually, we've got one about egg freezing, so we'll do that in a minute. We've got one about grading systems of embryos, I presume. So yes, do we have a grading system for patients who don't opt for care maps? So I can take that one. Yeah, we do, of course. And we have a decade of experience with time lapse, so we've been able to inform our standard practice or our non-time lapse care maps practice by that knowledge. So it's been amazing. So we've been able to, for patients who don't have care maps, and it's not for everybody, then we can use that knowledge to improve the timing of assessments more than anything else. And we've also learned that morphological assessment, so just looking at the shape and the form and the number of cells that the embryos have got, isn't always that reliable. There's much more to it. So the kinetics, the developmental timings are really helpful to give us the best chance of getting the best embryo, because most patients have a number of embryos. And what an important decision it is to choose the best one first time. So we do spend a lot of time considering this. And often if they look the same, then we'll get colleagues over to really make the best possible choice. But what we're looking at, if we're not using the care maps, is the number of cells, the stage of development. And if we get to the blastocyst stage, which is always the aim, then we will grade the 2 cell types that we see in the blastocyst. There's the trophectoderm, which is like almost like a necklace of cells all around the periphery of the blastocyst, and then the inner cell mass within it. So we can give an assessment and a grade to each of those types of cells, which will help us choose the best. We've got pictures if any patients want to have a look, and we go through them together, and photographs, and really help patients understand, because some patients say, you just do work your magic, we trust you, and other patients, they still trust us, but they want a lot of information. And that's great, because a lot of us are geeky scientists and we like to look at the images and talk to patients about it. So we accommodate everybody however they want to get that information delivered. There's a question just to say, can we briefly talk about intrauterine insemination? I mentioned it too briefly probably in the presentation. So if you could give us the lowdown, facts and figures if possible, please.
Yeah, so IUI is a procedure where we're inseminating sperm, whether that's your partner's sperm or donor sperm. And we do that by essentially cleaning and preparing the sperm in the lab, first of all. And then we time the time that we put that back for the patient's cycle, so your cycle. So the way that we do that, there is a couple of different options. So we can just use your natural cycle. So if you've got a regular period and you're ovulating, then we will keep scanning you, usually from around day 10 to 12 of your cycle, until we see that you're releasing or you're growing a dominant follicle. And then we try and match up when you're ovulating with when we put the sperm back. Okay, so it's relatively straightforward. We might also do some blood tests during that process to make sure that we're timing it perfectly. The other option is that you might not be ovulating, or a consultant might say to you that we need to try and increase your chances by getting more than one follicle to develop. And if we do that, then we can either do that with a tablet or we can do that with injections. Most people that we treat for IUI, we do it with the natural cycle. Now, your consultant will really talk to you about whether that is the best treatment plan for you or whether IVF is the best treatment plan. So per IUI cycle typically depends on your age, but typically it's around 12 to 10% per IUI cycle in terms of the live birth rate per time that we do it. And that's why, to account for that, we recommend signing up for maybe at least, or considering having 3 cycles of treatment in order to give yourself the best chance, and that makes it a little bit more cost effective for you as well. But yeah, your consultant will really talk to you about whether that's the most appropriate option or not. If you are going to do an IUI treatment as well, we might also recommend having your tubes checked to make sure that they're patent, because of course we don't want to be putting sperm in the uterus if the sperm can't meet the egg and you've got blocked tubes.
Yeah, that's a big word, patent. It's not like shiny shoes, it's open. Yeah, the tube is open. Yes.
Yeah.
Great. Should we talk about egg freezing a little bit? And do you want to talk about the question is, how old do you have to be to freeze eggs to plan for your future family? So if you talk about that bit, and then I can maybe say a little bit about egg quality and violet.
Yes. So there's no cutoff for when you should be freezing or when we can freeze your eggs. We can always facilitate what you want to do. But there are times where it's going to be more effective. And ideally, we would say to you, if you can do it before you're 36, then that would be a good time to do it. And that's because we know that is when your egg quality is at its best. So if we come to use these eggs in the future, they're more likely to form a good quality embryo that is able to become a healthy baby at the end. And of course, as well, you're more likely to have a higher ovarian reserve or egg store. So when we stimulate you, you're more likely to have a good, successful outcome because you're going to get more eggs at the end of it. However, of course, some people do come to us and wish that they'd thought about it slightly earlier in life, and that's absolutely fine as well. And then your consultant will talk to you about ways that we can try and support you to try and maximize your chances of freezing enough eggs. It's just the fact that if you're a little bit older, we might need to account for the fact that you might require more eggs in order to ensure that you've got a good chance of a live birth in the future. And I suppose, Ali, you can carry on talking about egg quality and why that's important.
Yeah, and it's probably more than 5 years ago that we decided to really look at the data, because it's still it's not so much now, but 5 years ago it was still a relatively new procedure to freeze eggs for fertility preservation purposes. So we looked at all the data and we did some maths and calculations, because until then, if you went to have your eggs frozen, you just have one stimulation, your eggs would be frozen, and that's it, you've had your eggs frozen. But some patients would only have 6 or 8. And so we did some calculations, and we need a good number of eggs. So we introduced a package, really, a treatment called Egg Safe. And so it's effectively you are trying to have a number of treatments, stimulations, so that we get a good number of eggs in the bank to give you a really high and realistic chance. So I think that was a real step forward, that we understood that we need a minimum number of eggs to give this high and realistic chance, because we don't want to freeze just such a small number that the chances are so slim of them working in the future, because it's an insurance, really. When you freeze your eggs, it's like saving anything else. You save it in case you need them. And if you do need them, you want them to be effective. And the other thing that we've got now, which is quite remarkable, is an artificial intelligence assessment of the eggs. I think we're the only group clinics in the country offering it this way. So we do an assessment of the eggs before we freeze them, in order to give the patients a beautiful report with photographs of each of the eggs, and also a calculation of their likely chance of success. So it really helps them understand where they are, and it helps us inform whether or not we need to try and bank some more for them. So I think that that's been a big leap forward in the last 5 years or so. Right, we have quite a specific question, but I think probably if you talk generally about it, we'll get a few important points through, and it'll probably be interesting for a lot of listeners, watchers. So it says, Dr. Tom Bamford, have you had any success with patients with a low AMH doing IVF with their own eggs? This patient is 35 and has had 2 pregnancies, 1 ectopic and a miscarriage. AMH 0.04, antral follicle count 9, and she's struggling to find the right treatment and the right clinic by the sound of it.
Well, yeah, I mean, absolutely. We've definitely had successes. Really, I think what should happen when you've got a low AMH is we should be really truthful about your chances of success over maybe a number of cycles, and therefore have a conversation with you about how we can plan your treatment in order to ensure we're giving you the best chance of success. So the risk really is that in a cycle, if your AMH is very low and we're only getting 1 or 2 eggs, those eggs have all got to do the right things, and that's what we've got to count for at the start. So that egg has to be a mature egg, so they're the ones that we want to use in the treatment. About 80% of them are mature, 8% usually fertilize, and then about 40% of those that fertilize form that blastocyst that Alison was talking about before. So you can see if you're only starting with 1, 2, or 3 eggs, the risk is that you might not have a blastocyst at the end. But we do have treatments at Care that account for that. So we, for example, have double stimulation cycles, or duo stim, or embryo banking packages. And it really depends, again, on your age. So the person asking this question is what we would consider as quite young. So therefore, even if you only get 1 or 2 eggs, your chances of success in IVF are still very good. And recently, for example, I had a patient that had really, really poor ovarian reserve, and was essentially had early menopause, and she's pregnant and just delivered a baby recently. So it is completely possible. That was on her 2nd cycle. She got 1 egg, it fertilized, it did all the right things. And that's what we can talk to you about, is how we can maximize your chances and individualize your treatment. So we've got lots of additional treatments that we can use to try and make sure we're making the most of the eggs that you do get.
Good answer. Yeah. You know, that's the thing. And yeah, where there's an embryo, there's hope.
Yeah,
exactly. We have some wonderful stories, and yeah, it keeps us going. And when our patients come in and see us with the babies, it's a very special thing.
And it's very hard when you've got patients in front of you, and you can never say this will never work. I mean, occasionally you might think that it you know, if someone's very old or they've got very low AMH, but in general, we can never say that. There's always hope, and there's always things that we can do, and lots of success stories out there. So that's what we need to hold on to, I think, and try and stay positive.
Great. Right, so we'll wrap up the question session. Thank you very much, Tom. And we have another short video, and then I'll just come back at the end and do a final wrap up. I think I have to play this one myself, so I can share a video. It's a nice one. Right.
I'm Shah, and I manage Care's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about Care Pay, our range of funding packages which are exclusive to Care Fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So, if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose Care was just
One, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of, well, one size fits all, but with care that didn't seem to be the case at all. They took everything into consideration, and they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you, and, you know, fingers crossed, will give you that positive result at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to care.
Oh, the support at care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
looked after,
cared by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic. We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what care can offer you. To provide you with the best care possible and to give you your best chance of success in treatment, we look to our own care family. From our consultants, embryologists and nurses to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some, and that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice, or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are care.
Well, I hope you found this evening informative. I'd just like to thank you again for joining us and for all the interesting questions. Please do send us your feedback. I hope our passion and knowledge does shine through. And we will get back to you if you send any further questions by email. And thank you very much again.
One in 6 people need help to grow their family. You're not alone. And our care family will do everything we can to help your dream of family come true. There are over 50,000 care babies in the world today. And behind this success is our promise to make more heartfelt dreams of family become reality by ensuring our care goes into everything we do for all our patients every single day. You will receive truly individualised treatment, a patient-centric approach with empathy at its heart. We understand how nervous and excited you might be about getting started, but you can be assured of kindness, empathy, and all the information you need from our new patient inquiry team. We are all here to make it easy for you to take your very first step in your fertility journey. Call our team on 0800 564 2270 to learn more and book an appointment. We don't just care, we are care.